My back is to the screen, Jay. So I
Okay.
can't see. So, okay. So Jason van Rooyen is going to speak to us from England. What has happened at the Diamond Light Source is the creation of an electron microscope cluster of beamlines, really, which enable people to use electron microscopes, cryo-electron microscopes, in the same way that they use synchrotron beamlines. So Jason is in charge of the commercial branch of this operation. And what he does is he enables drug companies to use the cryo-electron microscope in their work. And I think that's enough introduction, is it, Jay?
Yes, let me tell them, Trevor. Thank you.
Yeah, yeah, yeah. Okay. Okay,
So
you go
thank you
ahead.
very, as Trevor said, morning everybody. I look after the commercial cryo-EM platform at Diamond Light Source, and it's a great pleasure to talk to you today about how about how facilities can help industry adopt cryo-EM. And it's a particular pleasure for me because UCT is where I first was interested in cryo-EM, and I also received one of the best educations in the world thanks to Trevor and his excellent team. So a little bit of history about how we came to be. For those of you who are not familiar with EBIC, it's the National Cryo-EM Facility in the UK. It's now 10 years old, and it's situated in Oxfordshire, Harwell, at the Diamond Light Source. You'll obviously be aware that we don't use the storage ring. It's not necessary to be at a synchrotron to have a microscope facility, but the brains behind the operation, who came up with the idea, Helen and Dave from Oxford and Birkbeck, realized the potential of integrating a facility with a synchrotron, where you can tie into all of the user logistics and all of the support structures that are really necessary to make a user program possible. And this was funded by a number of large grants, well, a large grant from a number of funding agencies, mainly to fulfill the mandate of offering free at the point of access cryo-EM facilities to the academic program in Europe and in the UK. And to do so, EBIC obviously houses a large number of incredibly expensive microscopes. There's the fleet of transmission electron microscopes, which are used predominantly for single particle and tomography analyses. But in addition to these, there are a number of preparative microscopes, which are used to work samples up to go into these microscopes, particularly for in-house projects for the research scientists pursuing their own research agendas. And these include 200 kV microscopes, Talos and Glacius microscope, some of which are shared with adjacent research organizations like the Research Complex. And similarly for the tomography workflows, because of the amount of preparative work necessary to move samples on through the tomography workflows, there's a number of instruments, some of which are also access is shared through our neighbors, such as the RFI. But in addition to the instruments, which are housed obviously in the microscope labs, there's preparative labs for the in-house projects and commissioning work. We also have a large communal user facility, control room where users can come on site, or used to come on site for COVID. I'll talk about that a bit later. And because of the nature of our field, we're obviously heavily dependent on compute resources. And this is once again where we tie into the synchrotron's GPU cluster. And we're very lucky to have that resource funded by Diamond. So arguably more important than the instruments are obviously the brilliant scientists who run the user program. And as I mentioned, EBIC itself, its principal mandate is actually academic, is delivery of the academic research access. And the most recent addition to that team, dedicated to that team, is the data analysis group, which has moved from the IT group into the research side, which helps them focus on developing tools for the cryo-EM user program. And again, I mentioned it, but it's really important to understand EBIC wouldn't be what it is without being able to utilize the integrated synchrotron services, such as shipping, user facility, legal resources, health and safety, and all of those departments which work tirelessly to support the MX and other beamlines also help EBIC. And again, the principal mandate of all of these people is to deliver a user program. And I think the publication record is evidence of their success over the years in doing this. Just in terms of the number of structures that purely from EBIC have now contributed been contributed to the PDB or the EMDB. So, I told you EBIC's been around for 10 years, but industrial interest in electron microscopy at Diamond started about 2 years after EBIC itself was up and running. And a trend which has continued throughout the last 6 years is that the initial users wanting to do, I can't obviously name names, but the initial clients wanting to do cryo-EM at Diamond came through a connection through MX. So my boss, Elizabeth, runs the industrial liaison office, and you can imagine that synchrotron has been helping companies do X-ray macromolecular crystallography for many, many years. And many of these companies are the ones which approach us to do cryo-EM. So we rapidly outgrew our 10% allocation, which was the permitted allowance on the academic microscope program. And we sought a way to expand the capacity of the service. And at the time, Thermo Fisher saw the potential in an engagement with us. And we went into a collaboration with them whereby they provided a Glacius and a Cryos microscope for us, in addition to 2 brilliant staff members, Rishi and Asfrel, who worked together with myself and Adriana to build up the pipeline and help the clients. And this collaboration ended last year, where we are very fortunate that Diamond took over full ownership of the microscopes, and we are now a Diamond exclusive team. So where we differ from EBIC, as EBIC for industry, is that in addition to obviously just offering data collection services like EBIC do, we can actually take the service a bit further. And we offer a full service pipeline all the way, to paraphrase it, from tube through to structure. And we're able to do this by offering access to not only the dedicated Cryos and Glacius microscopes, but also my excellent team, who are basically full-time scientific consultants for hire on projects. And the distinction here is that we offer on-demand access. You're probably aware of the Cambridge Consortium, which pre-existed the efforts of Diamond to help industry. And this was a consortium, again, with Thermo Fisher partnering with several companies to offer dedicated access, whereby they pre-bought allocations on Cryos microscopes. Our business is a bit different in that people approach us whenever they need microscopy, but they're not committed to use us for any length of time. And as I said, we offer the full scientific consultancy. We're particularly proud of this because we really believe it allows us to offer an objective assessment of project suitability and progress. So we pride ourselves on giving honest feedback and really existing to help companies de-risk the adoption of cryo-EM. They often come to us before they invest, even in scientists, let alone microscopes. And by proving the usefulness of the method to their specific research projects, we help them make the internal decisions as to whether they want to try cryo-EM, adopt cryo-EM, and ultimately invest in technology. And that's a trajectory that many of our customers have followed. And I'm beating this drum often, but again, we are really grateful for the user data, logistics, and legal functions at Diamond, which really help us offer a slick service to many companies. Because when you're dealing with multinational pharmaceutical companies, even just contract negotiation can take years. And finally, we really are a unique offer, I believe, in the sense that we integrate with the other structural biology services at Diamond. So we have some customers who are looking at samples, not only with cryo-EM, but also with SACs, and sometimes even with our neighbors, for instance, at ISIS. So neutrons, SACs, and EM, all on the same samples. And I alluded to this slightly, but I just want to go into a bit more detail. Our pipeline is scalable enough that people can enter and leave our pipeline wherever they want. So we really do have a large range of customers with varying expertise, and this has changed over time. So one thing we focus on particularly is to try and train our users such that we can scale their abilities to use our resources. We can't be a CRO to everybody. There are only 3 of us. We only have 2 microscopes. So our principal mandate really is to get people moving through this learning curve such that they can ultimately move up. I just want to put on a pointer, sorry. So if you look at effectively our client base and what they use us for, an increasing level of experience, you'll obviously realize that the clients want less of our services. We often have groups coming who have no concept even of structural biology, but simply want to understand a sample from a structural basis, and in which case we then have to do the entire workflow. We have companies that have crystallography experience, and this, I would say, by far and wide is the majority of the type of customer who comes to Diamond. And these are groups with crystallography expertise, wanting to learn cryo-EM and to test whether it is a technique they want to adopt. And they generally exit the pipeline at data processing because they're not yet familiar with that, but they're more than capable of building models and interpreting the structural insights. And then as you move up in the experience scale, you obviously get companies that have now bought into the concept, some of which we've trained ourselves, and having progressed to the point where they've invested in staff, hired cryo-EM scientists or trained crystallographers to become scientists. They then access us for screening, data collection, and leave at that point where they do the processing back at home. And then ultimately, we also have companies who even own their own microscopes, some of which cryos, who access us just for additional resources. So then there is never enough beam time on any instrument, and those with the money are able to access Diamond in addition to their own in-house resources. And the way we help our customers to meet this mixed bag of users who want to use us is we have different access modes, which pretty similarly mirrors what happens in the MX villages. There's the rental model, which is where users are welcome to come onto site. They use our labs. We have dedicated facilities that they can use without any supervision other than support if something goes wrong. And they're also welcome to use the microscopes in person on site. But as I alluded to earlier in the talk, COVID has basically changed everything. Everyone, I wouldn't say they've become antisocial. Let's just say they've become more efficient. But everybody prefers to collect data remotely now. And we have people locally, people across the country, and people internationally who send us grids, log onto our microscopes, us having set them up and optimized them, obviously, and they then log in and collect data themselves. So they do not have to own these instruments, but they choose to own the preparation facilities as close to the cell culture or as close to the protein purification systems as possible, which is a very good idea. We also have mail-in, which we often find are companies that are really invested in structure-based drug design and have invested a lot of resource in cryo-EM, but really just need additional capacity. And they are just sending us pre-optimized grids for our scientists to collect. And finally, as I said, we often act as a full CRO for many companies, freezing, screening, collecting, and solving structures. But our raison d'etre, as I said, is training. And this is where we really differ from other CROs in the market who are offering cryo-EM. And that is in principle, the idea that we want to train our user base such that they can help us move their projects further. The more they learn, as you see, as they move up the pyramid, they can ultimately just send grids and log into the microscopes rather than the three of us having to work on moving the projects from the lab all the way through to structures. And in addition to EBIC's fantastic courses that they offer where industry participants are more than welcome, we offer hands-on dedicated training to users. And we're particularly proud of the model where users come for several days to actually progress real projects. And we found, unsurprisingly, that this is really important to helping them make the decision about adopting cryo-EM, because a lot of companies, although they have budgets, don't have a lot of exploratory R&D budgets. So if the scientists can convince their purchasing managers that they can actually push a project forward while trying and learning EM, it really does make a difference. And these obviously courses can happen in person or again after COVID remotely. So there've been a lot of changes over the years, but I'm particularly grateful to Diamond for their investment and for their vision and understanding that if we don't keep these instruments cutting edge, the services can never actually be a benefit to the pharmaceutical industry. So I said we've been operating now for 6 years, 2 years shorter than EBIC itself. And we've had a number of upgrades over the years. The biggest change for us, just to highlight, is the change to the Falcon 4i and Selectris on our cryos, which has been a real game changer in terms of how the facility operates. I'm not saying the Falcon 4i is a more capable camera than the K3, but it is just a far simpler instrument to operate. And this has allowed our users to really benefit from that. We've also now acquired internally at Diamond dedicated labs, as I said, that the users can come and prepare their own samples. And we have a fantastic team, including Hazel and Manny, working for me at the moment. So I'm not going to geek out too much for the non-microscopists in the audience, but just to say that these upgrades have basically resulted in the current situation where we are heavily invested in the Thermo Fisher EPU ecosystem. Again, there's some brilliant pieces of software out there that can rival EPU, if not surpass it. But we've chosen to go with EPU because it really does allow us to train our users quickly, and it allows users with training at other facilities to take advantage of our microscopes without having to be retrained. And so we obviously, through the EPU ecosystem, we have APHIS for high-speed data collection. We have fringe-free upgrades, again, for higher speeds. We've recently moved to plasmon imaging with our customers. We're running a workshop on that pretty soon. We rarely, but do tilted data collections for several users with troubling projects. Multi-grid is a staple for screening, and we've had a few hexafoil grids pass through our hands now at the moment. So the way we work is we basically offer preliminary screening on the glaciers, including preliminary data collection if people want, and we try and then move projects onto the cryos. I now say high throughput data collection on the cryos rather than high resolution data collection, because more often than not, the glaciers is capable of 2.8, 2.9 resolution. So the biological insights can result from the 200 kV microscope, and often it's not necessary to go to the cryos. However, it is far more efficient and obviously necessary for tomography workflows to use a cryos, and in particular with an energy filter, it really does make a difference for troublesome samples in thicker ice. And one thing to note in screening is that we really do not have a bottleneck, but we see it as a bottleneck for the clients to find the right grids to go onto the cryos, which is only fair if they want to optimize the amount of money they're spending on the cryos. But we are now loading our glaciers 3 times a day for several clients. So that's 11 grids 3 times a day, and they then still collect overnight just to get through the number of grids necessary to make a selection for the cryos. And one other thing to highlight is that we try to get our users to operate in select data collection modes, and this allows us to have the microscopes pre-optimized, and they really are just working within the EPU ecosystem to choose their squares and get the data collection running rather than re-optimizing the microscopes. Unfortunately, you can imagine, I can't talk about details of what my clients have done with us over the years for obvious reasons, and it's pretty much why EBIC for Industry exists. It's to offer the confidentiality which EBIC itself doesn't, because they require you to publish if you use them. But what I want to highlight is a number of areas where cryo-EM is being deployed to study structural problems for biomedicine. And I can tell you that we've worked on each of these type of samples, not the ones that I'm showing you here, which are from academic literature from samples collected at EBIC. But you've heard some fantastic talks today, and I see you're going to hear a few more. It's obvious that for large, often membrane proteins, nucleic acid complexes, cryo-EM is revolutionizing structural biology because you don't have to crystallize things. And then often it is the method of choice, in particular for things like GPCRs, where if the sample preparation can be worked out, it is a far simpler pipeline to develop. And there are now companies that purely focus on developing drugs against these targets using cryo-EM. The other common one is obviously flexibility and allostery analysis, which you cannot get from X-ray crystallography. The ability to see domain motions, in particular now with the software that's teasing out these types of continuous motions or discrete motions. It's possible to now actually understand the effects of drugs on allostery and larger, higher order structures, which is not necessarily possible within the constraints of crystal systems. Studying amyloids has now been made by Shores, and his group has been made almost trivial. And there's obviously a lot of disease pathology in terms of the actual packaging, stacking, aggregation of these amyloids that's being studied by cryo-EM. And then the bread and butter and 90% of what we do for clients is single particle structures of ligand-bound proteins. And there the goal is obviously a high enough resolution to interpret the density of the ligand. And this is fed back into medicinal chemistry pipelines where they try and improve the binding the affinity of their targets. And then also protacs and molecular glues. This is an area which is particularly suitable to cryo-EM. But just to highlight some things that may be not that obvious to the pure structural biologists, and that is we're seeing an increase in the number of bioengineering projects. So this is, for instance, what Trevor's been doing for years, trying to understand and optimize the catalysis of biomolecules using structural biology, and where amenable, obviously, cryo-EM. Biologics epitope mapping, the idea that you do not need very high resolution to actually map the footprint of an antibody. Cryo-EM is fantastic for this. You saw Kurt's talk just shortly shows that how amenable this is. And then rational vaccine design, where you can actually, as evidenced by COVID and all of the antibody structures done during COVID, it's a really quick turnaround to actually understanding the epitope that antibodies are binding. And I just wanted to highlight some of the work that our director Pejin has done, where she's actually taken cryo-ET workflows to the point that they can image COVID trimers spikes within cells. So it's possible to determine the actual antigen presentation of the target within a cell for this given system. It's not broadly applicable to all systems, but it really just does highlight where things are potentially going. And then something that's quite close to my heart at the moment, because I'm seeing more and more of it at the moment, and I think it really has potential to impact on a wider scale, economic scale as well, is biomanufacturing. So there's increasing demand for trying to understand drug delivery systems. For instance, gene therapy loading efficiencies, looking at empty versus full AAVs. So the idea that you can measure the efficiency of nucleic acid packing within these systems. And this is really a manufacturing problem where they need to understand how changing the manufacturing problem changes their drug substance and what the impact of that is. And cryo-EM is a fantastic way of actually visually answering those questions rather than inferring things through other biochemical or biophysical measurements. Similarly, lipid-based vaccine morphology and characterization of shapes and capacity. RNLPs, liposomes, these are all drug carriers, and they are increasingly being studied by cryo-EM to understand at the molecular level the structure-function relationships and how manufacturing changes that. And then to go back to the idea of amyloids, peptide therapeutics, the assembly, induction, and prevention. Many small peptide therapeutics are actually forced or made by the companies to aggregate such that they provide slow-release reservoirs. They therefore want to understand how they can engineer aggregation properties into amyloids, into these small molecule peptides. But equivalently, there are many companies that are actually trying to stop soluble peptides from aggregating because it becomes a problem for storage. So these are not molecular pathology questions. These are really manufacturing questions. And then finally, biosimilar characterization, whereby people are trying to license a new biosimilar and need to prove it is a similar to one that's already on the market to increase the speed of their legislation, access through legislation. So, it's fantastic to see what cryo-EM has done. But I would say not all the problems are solved. And I think a lot of these problems, if you will indulge me, I want to go through a few of these, represent opportunities that Diamond is looking to impact upon and thereby help pharmaceutical companies with the adoption of cryo-EM. So in my opinion, sample preparation still remains the most difficult to predict and common point of failure for the majority of projects I see coming through my doors. I would say data collection is almost a solved problem, and Thermo Fisher is working really hard to make microscopy and the alignment of the microscope and those types of issues the next AI-based solution that won't necessarily need microscopists anymore. But the bottleneck of preparing good protein and getting it to freeze properly remains. The other major problem is that there are no biochemical or biophysical assays that predict the freezability or the potential for orientation bias. So cryo-EM at 2,000, minimum 2,000 to 3,000 pounds a day is an incredibly expensive way to work out whether you actually ultimately would be able to do cryo-EM. So it really is, people have to reach a certain level of income to be able to afford to test the service, and it really is tragic. And finally, rational optimization, which is done in academia through how many different postdocs or how many different years of a research lab trying to push on a target. That can be done in parallel reasonably fast, but it takes time and money. So the solutions we believe to these, for instance, are technical solutions to try and outrun some of the sample problems. And Bridget's going to be talking a bit later. She's invented the chameleon. which we believe is one of the solutions that may help with this. And David Owen is running this instrument for Diamond. It's a collaboration with SDP. And the idea here is that through really high-speed freezing, you're able to potentially outrun some of these problems with the sample. So this is really an engineering exercise to try and outrun and improve one of the bottlenecks that we have in cryo. Yeah. And then as to the rational optimization that I mentioned, I just really wanted to highlight the efforts of the MPL, which is, again, an academic service, but we're looking to see whether there's any potential to do something like this for industry. And Pete Harrison, working with Andrew Quigley, the head of that lab, they do an absolute fantastic job of working up difficult samples, obviously membrane proteins, up to the point that they're amenable to not only crystallography, but cryo-EM. And it takes a large number of dedicated people with a lot of time working across many parallel efforts to try and improve these samples. And so this idea of having almost the equivalent of a crystallization robot facility whereby users could submit samples that then are optimized in parallel is a vision that we would love to pursue, but it needs a lot of working out how to resource. Cryo-EM lags decades behind MX with regards to structure-based drug design. You'll often hear the statement now, if you go to a cryo-EM conference, that single particle is dead. I don't believe this. I just think its pulse is too slow to measure. So people have starting to say it's completely solved. And one of the reasons for this is logistics are a complete nightmare. I would say we are at least 10 years behind where MX is in terms of how they handle samples. And with Diamond 2's upgrade coming, we're talking about 1,000 crystallography samples per day. I mean, the time it'll take cryo-EM to catch up with that obviously will be a while, if ever. But nonetheless, there are many lessons we can learn. And most of these limitations preclude large libraries of screens of ligands or fragments. So the companies that are doing fragment-based cryo-EM work are talking about solving structures in 2 days, all the way through from data collection to structure solution by computational methods. And you can imagine that the beamline's doing thousands of structures. Obviously, those are processed on the fly to get actual atomic resolution structures. So it's not possible to do the same number of 96-well plate screening ligands as you can with MX at the moment. And again, the collection software and the data processing software are not ready for this level of parallelism yet. So one of the solutions we believe is that we have to just try and improve these things. So myself and a couple of colleagues at Diamond were awarded funding through the Frag Screen project. This is a Horizon infrastructure project which aims to improve fragment screening at facilities. And we are working on the cryo-EM package where we are trying to not only develop an AI-based automated acquisition software. On my side, we're trying to develop a robot to actually handle grids and make the throughput at least resemble what happens in cryo-EM, in X-ray crystallography. So we're going to be building a storage and sample handling robot, which will manage all of the ingest of samples from users, rearrangement and loading of the actual cassettes, Thermo Fisher cassettes for the microscopes. And then finally, Bridget, I'm sure is going to go into much more detail about this, but we believe that tomography is obviously a field that industry is very interested in. At the moment, EBIC does not offer cryo-ET for industry, but there's obviously a large number of people working for academia. And as the cellular context of molecular disease mechanisms becomes more relevant, particularly because we have AlphaFold and Model Angelo, the problems are moving to larger scale and they're now tractable. But again, the sample prep and the imaging becomes the issue. And so James Gilchrist is running the fib milling service for academia. This is the idea that you have to thin cellular samples down to be thin enough to be imaged for tomography. Parajat is looking at CryoClam, looks after that program, which is allowing you to actually fluorescently tag targets within the cells such that the milling can be efficient and you can identify the regions of interest. And Dave Farmer is working on the commissioning of the serial cryofib instruments with the RFI. And we hope, we're having several conversations with several companies, but we ultimately hope to offer these services to industry. But you can imagine that the level of support required for cryo-ET is immense, much higher than single particle. And so we're starting off with industry-specific training programs and trying to run one or two select customers through this pipeline just to learn how to do this. And then finally, data processing is the major and most expensive bottleneck after sample optimization. And we are very fortunate to have an excellent team run by Dan Hatton, who's working on the fly data processing pipelines, which we currently use for our industry customers to process your single particle data set and observe the quality of the data as it's collected. But equivalently for cryo-ET, for the academic program, they've also now come up with a pipeline that allows you to get your tomograms in real time. Okay, thank you very much. If you have any questions.
Jason, can we see Jason's face on the screen? Can you switch to is your camera on, Jay?
Yep.
Or can why are we not seeing it?
Maybe I need to stop sharing.
Okay.
Am I back?
There you are. Okay,
Yeah.
great. Nice to see you again. Okay, so does anybody have any questions for Jason right away? Joachim wants to talk.
Well, this is really, this was fantastic. And I'm just wondering, you showed three phases there. Are you the only ones who are running this? Where are the other people? Do you have a larger staff?
No, it's just the three of us.
Three of you? Oh,
Yes.
God. How do you manage this? I don't
Well, I mean, the first point, if I can just answer that, is that, as I said, we have to, it's almost like becoming a postdoc, a contract postdoc for a short amount of time on a project. But our principal goal is to really push the training. And we found that for crystallographers, we can get them to a point that they contribute to their own projects quite rapidly. But yes, we absolutely are limited to the number of full service projects we can do because those are the most challenging.
Yeah. Okay. Very, very impressive. Thank you very much.
Okay, further questions for Jason? Okay, Jeremy wants to ask one. Okay. Jeremy Burgess, it is.
Jeremy.
Hi, Jason. Nice to see you again. Really looks impressive what you're doing. Just wanted to ask a bit more about the frag screen. Are you able to share a bit more about the details of how you screen a whole bunch of fragments in EM?
So we don't currently. This is the point, right? So
Yeah.
Nobody's doing it. Aztecs Pharmaceuticals, this is something that they do, right? They've published papers on doing fragments. I encourage you to read their papers. They don't give too many details, but the bandwidth is too slow. You as I said, I mean, in their cases of optimized targets, they're talking about 2 to 3 days from freezing to actually getting a structure. In our case, the fastest we've ever solved was someone coming on site with a large symmetrical protein with a ligand bound, and they were able to go home again in 3 days. So at the very least, you can do 3 a day. Takes 3 days to do 1 ligand. Compared to XChem, which is our fragment screening pipeline at Diamond, where they're doing hundreds of crystals, and those are hundreds of data sets because they guarantee to give you a structure, not necessarily occupancy in the active site, but hundreds of structures. We just don't think it's possible yet. What we're thinking is maybe fragment cocktails. So you wouldn't, for instance, you'd be able to do a select group of fragments, which are also importantly distinguishable from each other, because as you move to smaller fragments, the resolution you need to discern small changes in chemical rings, in carbon rings, for instance, is much higher. Okay. So we're thinking fragments. But in terms of the frag screen, our goal, our mandate is to make the robot such that we hope we can at least track samples, and we may not be faster with the robot than a human. Well, we would be a bit faster than a human, but we're hoping that the logistics mean it will run automatically. So that when people freeze grids, they're able to store them, they be able to move around synchrotrons with barcodes, and they can move in and out of the machines such that we can actually do it, let alone fast.
Sure. Thanks. Wonderful. Thanks, Jason.
So how many customers do you have, and how many projects have you done since you started?
I would say we've done hundreds of projects now over the 6 years. We have, as I said, we have different types of customers. We have about 4 who are using us just for beam time, and then the rest really does vary. It just comes seasonally as to when they want to come and try EM. Yeah, this is the question my bosses ask me all the time because they want to plot the growth, and it's just not possible sometimes.
Okay. Okay. And I think I have one final. Is it a viable business?
No. No, there's no profit. So I should have started with that. Good point. Diamond is a not-for-profit, and we do not make money off this. We make revenue. The revenue goes back to Diamond, but the microscopes are incredibly expensive. And we see it, this is why it exists. We see it as Diamond's mandate to be useful to society. And my division is useful to industry, which is really important for showing the applied science of sciences and how it helps ultimately human health, for instance. But EBIC itself, they're there to help knowledge generation for academia. But I would say both run at a loss. A financial loss, but a benefit to humanity.
Thank you very much, Jeff.